Recognize, navigate, and connect. Cancer is a disease that has touched every single one of our lives, whether it's through a close friend, a beloved family member, or ourselves. In fact, 1 out of 3 people will be diagnosed with cancer throughout their lifetime. That means that within this room, at our tables, that means either 2 or 3 of us will battle cancer sometime throughout our lives. We have really appreciated the opportunity we've had to get to know cancer patients and their families throughout this journey as we've interviewed them and learned more about their experiences. And we're excited to share what we've learned with you today. To begin, we'd like to introduce you to somebody who is a member of the Latino community here in Minneapolis. Meet Lauren. Lauren is a wife, a mother, a sister, a daughter, and she was diagnosed with stage 4 colorectal cancer when she was only 45 years old. And when she was diagnosed, life did not stop for Lauren. As you can see, she has a young son, a husband, a family, and her home responsibilities and work responsibilities did not stop during this time. Adding a fragmented care system, confusion about treatment options, and anxiety about test results and any delays in the system were detrimental to her. In addition, this created financial and emotional challenges that will continue even beyond treatment. So we proposed that mHealth Fairview, thank you. We proposed that mHealth Fairview roll out the following 3 initiatives: recognize, navigate, and connect. mHealth Fairview can help their patients recognize CRC early by sending at-home tests to those patients who are unwilling or unable to do a colonoscopy. They can also help the patients navigate their care better by specializing their nurse navigators, which will enable them to help more patients in a more specific, specialized way. And lastly, they can help their patients connect with the resources and the community that they need to heal fully after their cancer treatment. Let's look at Minnesota screening rates. Here we have the white demographic, American Indian, Black, Asian, and finally, our Latino population. As you can see, there is a huge disparity here with the Latino population falling at 41% screening. Not only that, but the Latino population is a growing population in Minneapolis. And the early onset CRC, meaning that the patient was diagnosed before 50 years of age, has increased by 45% in recent years. So we'd like to zoom in a little on this initiative. Conócelo, navégalo, y conectate. We know that with these 3 initiatives, mHealth Fairview will be able to meet patients where they are at. They'll be able to target with culturally competent care to the Latino population and be able to help them receive the care and the resources that they need.
So with that focus in mind, we are determined to address the social determinants of health that are affecting the Latino community here in Minnesota. As we've talked about, even though 41% of Latinos are getting screened, actually 83% of them are seeing their primary care providers. This means half of those that are going to the doctor are not getting screened. There are many barriers that are preventing this from happening, but among them are lost wages due to the preparation for colonoscopy, the colonoscopy itself, and the recovery afterward. Additionally, transportation represents a unique and specific barrier for this community as well. To mitigate this, we present the following proposal to you all. We propose that in the primary care setting, clinical teams work together to ensure that during the primary care visit, patients are scheduling a colonoscopy that day. However, if there are barriers that prevent them from getting that procedure, then we would send them home with an at-home Cologuard test. You may think that this is already happening in these settings, but the numbers just do not bear that out. So what that would look like for a patient like Lauren is she would go to her primary care doctor who would inform her about the unique benefits of colonoscopy as opposed to other screening mechanisms. However, if there are barriers that would prevent her from getting a colonoscopy and scheduling it that day, she would be sent home with a Cologuard test. We do understand also that there is the risk that people won't follow through with their colonoscopy or won't actually send in their test. So for that, we propose a research-backed proposal using Spanish language texte novelas. What these look like are Spanish language infographics that make understanding the procedures for sending in tests or getting a colonoscopy very accessible, very easy to understand, and very interactive. It's been found that 62% of individuals that were sent these it represented a 62% greater return rate for the Cologuard tests. Our proposal also represents the best standard of care because we'd be increasing testing for the community at large, and especially for the Latino population. Additionally, we would be increasing colonoscopies because individuals that get a positive test are 78% of those individuals are likely to go on to get a colonoscopy and enter the colorectal cancer continuum of care. Additionally, this represents the most culturally competent care that we can provide to our Latino community here in Minnesota. As we would measure the success of this program into the future, we would want to bring this community into parity with other demographics by reaching 75% screening. Additionally, we would measure the adherence to these protocols among our clinical and interprofessional teams to ensure that the clinicians and the administrators are actually working together to get this done. This would also be cost saving into the future because it'd be cost-saving because there would be less costs associated with late-stage cancers that are often borne by the healthcare system. We would partner with organizations like the Colon Cancer Alliance and CLUES, which is a prominent Latino organization here in Minnesota, to spread the word about our efforts and ensure that they know that we're doing the work to reach this vulnerable but very important population to Minnesota.
We are very excited about how this initiative can help improve outcomes for the Latino population and reduce the burden that colorectal cancer puts on these individuals. However, some of our patients will be diagnosed at stage 4. That means for people like Lauren, they get a devastating phone call that leads to fear and concern about what this will mean for their future and their family. They're not sure if they'll survive, if they'll lose their hair, and now they're headed into a very complex treatment routine, including surgery, chemotherapy, and radiation. Health systems have nurse navigation models to help support the patients in providing education on the treatment protocols, helping coordinate between providers throughout the continuum of care, as well as addressing any barriers to them receiving care. However, the current nurse navigator model is very complex. As you can see here, one nurse navigator is treating patients with up to 20 different cancers. They're interfacing with different physical, geographic locations, as well as the different care teams associated within those centers. As a result, when Lauren calls with symptoms that she doesn't understand or that are alarming to her, she gets an answering machine. That leads to concern, and she may not be able to follow through on the recommendations that her provider are giving her. As a result, we recommend that mHealth Fairview implement a specialized nurse navigation model. This means that one nurse navigator will be caring for a caseload that consists solely of colorectal cancer patients. By reducing the number of different conditions that nurse navigator is supporting, that nurse navigator will be more efficient and effective in the way that they provide support to the patients. They'll be able to give more targeted advice and help and have more touch points with the patient. Not only will this be better for the patient satisfaction and their experience within our health system, but this will lead to fewer hospitalizations as they'll be adhering to treatment protocols, as well as improved survival rates. As we implement this program, we expect to see patient satisfaction scores improve as they feel better supported by our system, as well as an increase in the number of touch points that our patients have with our nurse navigators. All of this will lead to an increase in gross profit as a result of the increased volume that our health system will see, as patients who experience nurse navigation are more likely to receive care within our health system, and that increased satisfaction and improved outcomes will lead to a higher patient volume over time. Additionally, there are some health systems that do this extremely well. The University of Pennsylvania and Intermountain have implemented nurse navigation models that have had a very strong impact on their patients and care. If we decide to expand this program or this pilot beyond the 6-month period, sources of funding include AONN as well as United Healthcare.
So, bringing things back to Lauren, she's gone through her chemotherapy treatments, her radiation, and now, luckily, she's had a nurse navigator there to answer her questions. And she's at that happy day where she gets to ring the bell, signifying the end of her cancer treatment. Me, personally, I was diagnosed with cancer when I was 24 years old. I went through chemotherapy treatments, I lost my hair, but I did have that happy day where I got to ring the bell. What Lauren may not realize, and what I didn't realize at the time, is that they can also signify the start of a new life. Lauren's going to think about cancer every single day for the rest of her life. She's going to wonder, how does this affect my family? How will it affect my kids? How will it affect those closest to me? It's no surprise that when you ask a colorectal cancer survivor what they need now that they are a survivor, for 3 years in a row, the top answers were all related to psychosocial support. As a team, we dove into the root cause of this and found, like mentioned earlier, life doesn't stop when you're going through cancer treatments, it keeps going. That leads to financial concerns, loss of purpose, and a desire for meaning and connection. If you look at the subreddit for colon cancer, there are 28,000 weekly visitors and 700 weekly contributions. Those are related to comments like, survivorship is so hard. I need some advice. I need motivation from others going through similar experiences. A mother said this on Reddit: the months since I finished chemo have been wonderful and so stressful. I'm youngish and a mom, and I try to take that advice about focusing on the present, but as a parent, I need to feel like I'm going to be here for my family in the future. That's an incredible vulnerable post that someone's putting online. But what if it wasn't just happening online? What do people need? They need connection. As a team, we propose mHealth Fairview create an annual colorectal cancer connection event where survivors, current patients, their nurse navigators, their families can come together and gain support from one another. Now, what this would look like for mHealth Fairview is we'd have community partners, breakout rooms where they can sit down with a financial counselor, a mental health coach and counselor, a genetic counselor that can help them understand how this may affect their families. We'd have keynote speakers, but also provide cancer survivors the opportunity to share their story to a group of people. We'd have affinity and peer connection groups where people like Lauren can connect with other Latinos going through similar situations as her that have similar backgrounds. And also we'd add nutritional support so they can continue to live healthier lives going forward. This shows ultimately that mHealth Fairview cares about Lauren not only as a cancer patient, but for the rest of her life. A metric for success would be we'd want to have 800 people attend this first conference and have an 80% positive nurse navigator follow up with them. The cost associated with this is $75,000, but we recommend mHealth Fairview partner with other organizations here in Minnesota that also have a deep care for the people of Minnesota. And those organizations would be Medtronic, United Healthcare, Target, and US Bank.
So to summarize, conócelo, navégalo, y conectate. So we know that mHealth Fairview can help make the biggest impact on these Latino patients through these 3 initiatives. Not only that, but these initiatives are directly aligned with mHealth Fairview's vision and mission to heal, discover, and educate, which ensure longer and healthier lives. For example, our sending home screening tests will help patients discover CRC early, which helps them be able to get the treatment they need early on and promote healthier and longer lives. Our specialized nurse navigation model will educate about treatment options and help us view the patient in a holistic way, not just about getting them treated, but also helping them with all of the other side effects that we've discussed in this presentation. And lastly, our annual CRC Connection event will help educate the community about CRC, increasing awareness and providing a supportive community for CRC patients and making it go full circle back to screening. We know that behind every number, there is a story. Lauren, Matt, and all of the people you know in your personal lives who have been affected by cancer. And we know that with these three initiatives, mHealth Fairview will be able to ensure longer and healthier lives for everyone in the community. Thank you.